My name is Samis. I'm a health policy consultant. I'm based in Edmonton. I'm also chair of the Imagine Citizens Network, chair of the board of the Imagine Citizens Network, and a sort of a grassroots Alberta-based organization that's really concerned with elevating the citizen voice and making sure that that informs what we do with healthcare across the province. One of the things we've done at Imagine is really try to hold conversations with people in communities throughout the province. Really interested in having more conversations with people in rural Alberta about what matters to them, what the needs are for healthcare, what's important to them, what they want the healthcare system to be doing better, and ensure that we're responding to the needs of communities across the province, including rural communities. We do that in a number of ways. We hold engagement sessions. Sometimes the Alberta government will contract Imagine to have conversations with members of the public. That happened during the Modernizing Alberta's Primary Care System, for example. We received some funding from the province to do that. And we've launched a major initiative across the province called Care Opinion, which is an online moderated platform that allows people to bring both what's working well in healthcare and what's not working well to the attention of their providers, and creates a moderated feedback mechanism so that providers can learn what their patients and caregivers think, and people can have their concerns or issues that they raise addressed back by those providers or back by the organizations that they're getting care from. Yeah, well, I was Deputy Minister of the Yukon from 2017 to 2022, Deputy Minister of Health and Social Services in the territory. And it was an extraordinary opportunity to really learn a lot about rural and remote communities and healthcare, and trying to ensure that we get services to people who are in remote communities, to improve access to people who have to travel great distances, even to a regional center like Whitehorse, and then often have to be transported out and to the south to places like Vancouver. So we really realized we needed to do much more in terms of creating hub and spoke models in the communities to get workers from a particular community out to other communities, as opposed to everybody traveling in to centers. We also really need more mobile care going out to rural and remote communities. So where the care is coming to communities and they don't have to always travel into a major center, especially in winter conditions, when there's bad weather. It's really challenging for people to constantly be on the move from their home communities into ever increasingly larger centers. So trying to bring care to people. The other thing that we really learned was that there's a very special kind of person that wants to work and live in remote communities and thrive in them and love the communities that they live in. But they're not for everybody. But the people who do take the opportunity to go into remote communities and live and serve the communities that they're living in, I've talked to so many in the Yukon who loved it and loved the people they worked with. But one of the things that we did do to try to maintain as many people working in rural communities and remote communities as possible was we offered people rotational. This was really key for nursing and mental health workers, for example. So people might go in and work for 6 weeks or a month or so in a community and then circle back into Whitehorse and then go back out into communities. It allowed people who didn't want to be permanently living in a remote community but loved serving people who are in remote communities to be able to sort of come in and out, but there was still a pretty good continuity of care because people knew that provider would be back about every 4 to 6 weeks. So it really helped stabilize our workforce actually in remote communities. My biggest fear around addressing the care issues in rural communities, in Alberta and across the country really, is that we are not going to quickly enough respond to the needs of those communities, that we're not going to put the kind of care models in place of interdisciplinary care that we need to be able to ensure that care can continue to exist in these communities. My biggest fear is that we're going to start losing the viability and the vibrancy of our rural communities as people just don't get the care they need. Rural communities are critical to the future of Alberta, but health care is critical to the livability and the viability of those rural communities. So health care is really critical. It's foundational to the success of rural communities. So my fear is that we're not going to be responsive and quick enough, and that we're not going to engage with the communities themselves to understand what they need, what they want, how we can best work with communities and citizens living in those communities to meet their needs. That's my fear. My hope is that I think we're starting to see a change in that regard. I think the government has prioritized rural health. They're putting a lot of attention into rural health. They've created a branch within Alberta in the ministry to be able to really focus on our rural health care. So there's an emphasis within the government that this is something we need to do, we need to pay attention to. They're starting to look at different care models, even in emergency departments, more use of nurse practitioners, et cetera, so that we can keep some emergency departments open when we have staffing shortages. And I think the other hope is that we will be able to engage with citizens. There's more and more engagement going on and understanding what people want, what people need. And so I think my hope is really a reflection of my fear, that my fear is that we're not going to act quickly enough, but my hope is that the work that we're doing now will actually bear some fruit going forward, because we really do need to listen to what people in rural communities need. We need to understand where and how people are traveling for care, and we need to be as supportive as we can. What programs can we bring closer to home? How can we support people when they do have to travel out of their community for care?